Hi everyone, thank you for attending our important webinar on the government mandate on vaccinations. I'm Scott Miller, Chief Executive at Volunteering Victoria, and it's my pleasure to be here this morning with you. I'd like to acknowledge that we're tuning into this webinar from the traditional lands of Indigenous people across Victoria. The Volunteering Victoria team based in North Melbourne acknowledge the Boonwurrung, Boonwurrung and Wurundjeri Woi-wurrung peoples, and we pay our respects to them, their culture and their elders past and present. I'd also like to acknowledge the expertise of our guest speakers, Gary Alessandros, Deputy Secretary of Children, Families, Communities and Disabilities Division at DFFH, and Lucy Percival, Director, Directions Policy, Public Health, Public Strategy and COVID-19 Response Health. Before we hand across to Gary and Lucy, Gillian Garner, Policy Officer at Volunteering Victoria, is going to provide us with some introductory remarks. Thank you, Gillian.
Thank you, Scott. Good morning, everyone. Thank you for joining us today as we explore with Lucy and Gary how the current COVID health directives impact your volunteering roles and programs, and hopefully answer some of your questions. We very much appreciate Gary and Lucy making time to join us today. COVID has impacted the volunteering sector massively, and since early last year, Volunteering Victoria staff have fielded numerous calls and emails from individual volunteers and volunteer-involving organisations, with questions covering a huge array of issues as they attempt to deal with these impacts. As you know, volunteering occurs within all community sectors, and all of these are well represented here today. We have almost 400 registrations for this event, which is a really good indication of the need for this information session. Much of the confusion and anxiety has arisen from the lack of clarity as to whether volunteering could continue during periods of lockdown, and if so, how to do this safely. And there's not always a proper appreciation for the planning and management that goes into organising volunteer programs. The vaccine mandates have obviously created even further complexities. As the state peak body for volunteering in Victoria, Volunteering Victoria has worked closely with government in seeking clarity for our sector, providing resources, updates and advice when we could. As we at last emerge from a very challenging period, we want to explore the questions you have. The department wants to hear directly from you, the volunteering sector, to understand the impact of the directives. Preparation for this webinar, we have provided the department with a range of the questions we've received so far, so they're clear on the range of issues facing volunteers and VIOs. Lucy and Gary will provide us with an overview of the current directives, what applies now, how these directives may impact volunteering programs in different settings. We will then take further questions. You can use the Q&A function at the bottom of your screen. And you are welcome to post these either anonymously or provide your name. It is quite likely we may not have time to respond to all questions. We will attempt to deal with those that have a broader application, but if you provide your name, we will follow up with you after the webinar to ensure your questions are covered and answered or addressed in some way. We are recording this webinar and it will be made available to organisations and volunteers as well. And just to say, we are very grateful for the working relationship and partnership we have with the department. And we hope that this webinar will provide some clarity in your roles and for your programs, while at the same time providing valuable information to the department as they formulate directives for our sector that are clear and understandable. I'm now going to hand over to Gary and Lucy.
Thank you, Gillian, and good morning, everyone. Can I begin by acknowledging the First Peoples and traditional owners of this land, the Wurundjeri people of the Kulin Nation and the traditional owners of the various lands where you're all located today. I pay my respects to their elders, past, present and emerging, and to all elders who have joined us here today. I would like to thank Volunteering Victoria and thank you, Scott and Gillian, for facilitating this webinar. I understand a number of questions have been submitted that we will unpack and provide some greater clarity for you all today. I would also like to acknowledge the people participating in today's webinar. I know there are representatives from many of our hardworking and important community service organisations including volunteer organisations, neighbourhood houses, men's sheds and individual volunteers that have dedicated their time and efforts in supporting their local community. I wish to highlight the significant and importance of volunteering and all our volunteers, especially those attending here today, that selflessly contribute to their communities right across our state. The webinar today is an opportunity to clarify the CHO directions and what is involved in meeting these obligations on a really practical level whilst volunteering and working in a community setting or organisation. Today, we'll also provide an opportunity to answer some common and more detailed questions about the CHO directions and how they affect your organisation's activities. Importantly, while some volunteering activity has continued during COVID-19 pandemic, there have been some activities that have been put on hold. As we all begin to adjust to a new normal with COVID-19, the CHO directions can assist us to open up safely and pursue the activities that we used to be undertaking over the last little while, and particularly pre the pandemic. To start, I'm going to hand over to Lucy Percival, who is the Director of Directions Policy in the Department of Health and the Public Health Policy Strategy and COVID-19 response area of the department. And Lucy's going to take us through some key messaging from the CHO directions before we then launch into a number of questions. I know Lucy's also joined by a number of her team members, and I'd like to introduce and welcome Corey Brown, Sean Mullins, and Kwan Ho as well. So welcome, Lucy, welcome to the team, and I'll hand over to you to take us through the next section.
Thank you, Gary, and thanks for having me here today. It's really nice to finally have a little bit of time to be able to come out and engage with all of the groups that I know the directions have really affected a lot over the past 18 months. And we've often been under a lot of pressure, and we haven't had the time to be able to come out and work with you on how to make them achieve the policy intent, protect people's lives while making them as functional as we can for you. But that's definitely a goal we have going forward, is to try and be able to work more collaboratively to have settings that achieve our policy intent, but also help you be able to implement that and keep your the volunteers and any patrons we have safe as well. I know it has been a very difficult year, and there has been incredibly frequent directions changes. I myself have turned up after a couple of days of rest and been shocked by some of the changes that have come in, but the pandemic has been incredibly fast moving. And until now, we've had to be very responsive in short time frames. But hopefully, as we go forward, as I said, we'll be able to take things at a more moderate pace. And that is actually one of the wonderful things about having vaccinations out there, is we're able to slow down slightly and be able to work towards having directions that are far more functional and practical and implementable for people, and to be able to communicate that out in a more timely manner. So we really are entering a new stage of the pandemic. It's sort of not shifting to an endemic disease just yet, but you can probably tell from the directions now, they're a little bit lighter if you were inclined to print them out than they used to be. And it's the new wave we're moving to is a shifting of responsibility towards individuals and organisations, and being less prescriptive and less tightly constrained. But there's still clearly a very strong focus on protecting people. Vaccination is really a very large tool, possibly the main tool we have now to protect people and allow us to get back to life as usual, but with a strong focus then on protecting people who can't be vaccinated, so people who can't for medical reasons, or children under 12, and that's going to affect a lot of your work. I think we can probably go to the next slide. I just, first off, I think we'd like to note that the directions generally consider volunteering the same as work, and that I know has been confusing at times, but it is because clearly volunteering provides a number of essential services to people, and where that work has been aligned, where the volunteering work is aligned with paid work is something that has been permitted, as you are probably all aware of the authorised provider and authorised worker list. That was always permitted to go ahead, but I also know that a number of organisations have sort of scaled back their operations or put things on ice to ensure that they are protecting people. And now you're looking at ramping back up and getting things to sort of our COVID normal, whatever that looks like, and have questions about how we implement this, because it's a whole new world. This is not a slow transitional change like we have technology in our lives. This has been a really dramatic shift very suddenly. And so under Roadmap Phase D, there's nothing that's really prohibited, but there are some restrictions that still remain to ensure that we can protect health and safety. And a lot of that is shifting the responsibility to individuals and organisations and away from Department of Health for our living with COVID settings. And some of it is going to be a bit of a mindset shift. The directions have generally been the most restrictive thing in our lives for quite a long time. And, you know, conditions, OH&S conditions and other regulations have been alongside them, but in many cases less restrictive. And that's now shifting towards the CHO directions, in some cases being less restrictive than other regulations we have. And so I'd just like to, I guess, firstly outline where we are today for you and the settings that apply. In general, you'll find in the directions that all participants, volunteers and employees must be either fully vaccinated or have a medical exemption for non-essential services at community facilities, and that participants and clients must show proof of vaccination or their medical exemption before entering, that needs to be checked. You have an obligation to have a COVID check-in marshal present at the entrance to the facility to check the vaccination status of workers and including volunteers is something that an employer will need to keep a record of. And just noting that keeping a record doesn't mean keeping a copy of someone's vaccination certificate. That can just be noting down a person's name and recording what their vaccination status is. And then there's an obligation on the operator of a premise to not let someone who's not fully vaccinated and is not medically exempt or under 12 at 12 and 2 months to enter the premise for these non-essential services. Of course, there's limitations on how that can be done in practice with some people, but it is about taking the reasonable steps that you can to ensure that everyone who is on the premise for a non-essential service is vaccinated. However, there are, of course, recognising that community facilities and especially volunteering provides a number of essential services to the community. So there are carve-outs to allow exceptions for essential support groups such as drug and alcohol services. And in those cases, there's a maximum of 50 people or a density limit of 1 person per 4 square metres, whichever is the less. And then for where an organisation is providing other essential public services, support services like a food bank, providing access to amenities, there is no restriction on the number of people who can be there, and there's no vaccination requirement, but the directions require that the minimum number of people to provide the service are there. So we're still trying to protect people wherever we can. If you have a communal entrance, like sort of trying to keep people waiting in different areas is also requested, but it's not a requirement within the directions because we recognise that that's not always possible in all facilities where they're shared. If we could go to the next slide. So the key principles are ensuring that you've got your COVID check-in sign visible, that people are being asked to check in, and then a number of the additional conditions are additional items listed on this page are things that are recommended. A lot of this stuff you'll have noticed has come out of the directions if you read them as closely and detailed as I do. I hope you don't have to too often. And things like face masks are generally not required anymore. It's not that they're not effective, but it's about shifting that responsibility for risk management to organisations themselves. Rather than being prescriptive in all settings, it may still be relevant to require face masks, especially if you're dealing with a really vulnerable group of people, or it's there's a big group of children, because we know that it's still effective, and especially where people cannot be vaccinated. So we recommend it for in some settings, but there's no requirement on face masks indoors in most places anymore. And of course, keeping all of your other COVID safe principles. Hand sanitizer is still great. There's other colds and lurgies out there too. I know a lot of my team has been coming down with them since we've been getting back out there. So keep safe for all diseases. Physical distancing, making sure to clean high touch points and surfaces. I'd like to acknowledge we have had a lot of feedback that it's getting quite difficult to do a deep clean after every confirmed case. And it is something we're working on if we can find a more practical setting for everyone with regards to deep cleaning after a confirmed case. And then in ensuring that you're trying to sort of keep people separate if sharing community facilities between vaccinated and not checking vaccination status groups. The other thing that you may have noticed is there's been quite substantial changes to the diagnosed persons and close contact directions, which probably isn't something that a lot of organisations have thought a lot about over time, because it's something that the Department of Health managed. But that, again, is a part of that shift towards individuals and organisations taking more responsibility, like we do with the flu, where you kind of let your friends know if you came down with the flu the day after you had a dinner party. That's the setting we're going to now. We're expecting organisations and individuals to reach out and tell people, and in some cases there are obligations to do so, and in others it's a recommendation, because it's a reasonable thing to do if you've had a bunch of friends over, to let them know that they may have been in contact. Overall isolation for a confirmed case has gone down from 14 days to 10 days after the time the person gets a positive test. Then the obligations that are probably most relevant to you are those related to the workplace. So an individual, employee including a volunteer, needs to let their workplace know if they are a confirmed COVID case. And then once they have done that, there is an obligation on the workplace, so volunteer organisations included, to let any of the potential contacts of that person know, and let them know their obligations. So they'll need to work out who they have likely been in proximity to and contact with when the person was there, and then advise those people that they are required to get tested within 24 hours, and they must notify the workplace of their test result. Once they've had a negative test, they can come back immediately. There's no extended duration for them. There's only limited cases of close contacts where there's an extended duration of self-quarantine, where a person has not reported a positive test. So those sort of more casual contacts, workplace contacts, people are not kept out for the extended duration that they have been. And then the workplace also just needs to keep a record of all of those results as they come in. That's one of the obligations on them. So I think that's kind of the key things that have changed recently that I think are most relevant to volunteering organisations, but I'm sure I'll cover a number of more detailed parts of that in the questions coming up. Thanks, back to you, Gary.
Thank you, Lucy. That's very useful and comprehensive. We've included the links to the Victorian Government information and support, and I recognise that these are updated as we move through the roadmap. So it is important that you keep checking into those links. As Lucy said, it is a pretty dynamic environment and has been, and hopefully we'll get to a stage where it's less dynamic and more stable, but we just got to be prepared. So important for you to be able to check in and make sure that you've got the most updated information. These links help us obviously keep safe, decrease any need for closures, and keep services open and communities connected, which is so important as we move into this next phase. I particularly draw also your attention to the local community access grant program, which provides grants of up to $20,000 to support community organisations and neighbourhood houses to deliver activities that reduce COVID-19 vaccine misinformation and hesitancy. And this is really important information and I know that a lot of work is being undertaken right across our environment, and particularly through the significant volunteering efforts to make sure that we get the right information out, and that we combat some of the hesitancy with clarity of factual information. I also understand there are a series of questions that have been submitted, and Lucy and the team who are with us today will help us work our way through providing that level of clarity on the CHO directions. Of course, if there are questions that we can't answer today, we will take them away on notice and provide you with a more detailed response in the coming days. The key themes appear to be, but are not limited to, the essential service, essential worker and COVID safe practices, the requirements to check and store digital certificate records, working in both public, community and private settings such as churches, aged care and disability settings. And Lucy again will provide some further advice on some of these on top of what she's already provided. As we continue to transition to living with COVID-19, it is important that we look after ourselves and each other and reach out and seek the services and supports we need as we make the transition to living with COVID-19. I do want to take the opportunity to just acknowledge the massive amount of work that all of your organisations, all of your volunteers have undertaken through what's been a pretty extraordinary period of time over the last couple of years. And I want to thank you on behalf of the Victorian Government. We deeply respect and are extremely appreciative of all the work that you have undertaken through this difficult period of time, and obviously through an environment where, as we've said, has been pretty dynamic and with lots of changes that have needed to take place so that we can keep our communities safe. This slide has a list of resources that you might find useful as well, and hopefully the session will be useful to you. For us, it's important to understand the impact of the directions on the ground and gain valuable insights from your experiences, and we're keen to understand how the sector is applying the CHO directions in day-to-day operations. The dialogue we have today will assist us in to make those directions clearer, fit for purpose and much more user-friendly, which I know Lucy and the team are very, very committed to. So I'm going to pause there. I'm going to hand back to Scott, and we'll open up the Q&A session at this time. So back to you, Scott and Gillian.
Thank you, Lucy and Nagiri. That's wonderful to kind of run through all of that information. Lucy, I wondered, did you want to run through some of the general questions and address those before we start with the questions we're receiving now?
Yeah, I'm happy to. I've covered off a bit of the information on questions we've already received. Clearly they're the top things people are after, but I'll quickly run through the stuff we already have, and then happy to take some more detailed questions. I can see there's some great questions coming in the Q&A already. So I've already generally covered off essential public support groups and essential services. I think the only point that I may have not mentioned there is that a COVID check-in marshal isn't required if it's just the essential public support service or essential public support group or a health service that's being conducted at a community facility. If there's a number of different spaces and just one of them is being used for one of those essential supports, then the COVID check-in marshal isn't required for that area, but would be required for the rest of the premises operating with the vaccination requirements. And yet no vaccination requirement on any of the patrons for those essential support services, but you're likely to find that all volunteers, I expect, are covered by the mandatory vaccination requirement for workers in that case. And the second dose requirement, I believe, is this Friday is the deadline for that second dose. So there would still be a fully vaccinated requirement for that group of workers. Then have largely gone through the general obligations on community groups, which is having your COVID check-in marshal, asking people to check in if it's a vaccinated setting, and adhering to the patron caps, which is generally just on the support groups, essential support groups, one person per 4 square meters or a maximum of 50 people, but whichever is less of those two. And we received a few questions earlier about a positive case in a community group. So it's related to workers. I should clarify that point, that it is the workers being volunteers or paid staff where they're infectious and notifying the people there, the workers rather than the patrons. Like, I think, of course, there's a lot of sensible principles to apply that are outside the directions. As I've said, we need to think about how to manage risk ourselves and where we can let people know. So if we can let people know, it's a good thing to do. It's the sort of reasonable to give them the opportunity to get tested, for them to have the opportunity to protect their family. But the obligation is around the workforce predominantly at this time. Sorry, I'm just quickly trying to scroll through. There's a few questions that are quite similar. And I've covered the vaccination requirement for volunteers. So you'll generally find that there is a vaccination requirement, but you can check the full list in relation to the COVID-19 mandatory vaccination direction for workers. That's where they're likely to apply. And you must remember that if you've got volunteers, because not all volunteers are going to be face-to-face with people, if it's work they can do from home, they must do it from home unless they're fully vaccinated. Anyone who's not covered specifically by one of the worker mandatory vaccination requirements, if their work can't be done from home, they are permitted to go to work if they're unvaccinated, but it's very, very few people who fall into that group. But if they can work from home, they must be working from home unless they have provided evidence that they're fully vaccinated or exempt. So I think we should sort of address the challenge that has been the change to 12 and 2 months. I think it came as quite a surprise to a number of people that the age requirement for vaccination dropped last week to 12 and 2 months. And it's not 12 to give people who've just turned 12 the time to go and get fully vaccinated, but it was reduced. I think everyone had been so excited about all of the restrictions easing. There's a lot of talk of that the plan to reduce the age got a bit forgotten. And I know that that's been a bit distressing for a number of people. So we're certainly not ignorant to that. And it's been unfortunate that wasn't more clearly communicated, but amongst all of the joy of having major events come back and the football being back, I think it was really easy to overlook some of those additional restrictions coming in, including on general retail. It's not quite so relevant to your work, but it's clearly going to be relevant to everyone's lives. I know that that's difficult, but it was really important to be able to allow these great freedoms that we want to bring back to people. It has to come with the balance of protecting others. And the way that we can do that is by ensuring that everyone who can get vaccinated and is enjoying the freedoms that we have, that they are vaccinated. And there's been 12-year-olds have been able to get vaccinated for some months now. We certainly have plenty of slots available for people to go and get vaccinated, lots of walk-in locations. I know that will be disruptive if people have put it off for some period of time and they haven't had their first dose or they need to wait to get their second. But we are seeing a huge number of cases in younger people. The proportion that have been in children has been growing and growing. And because older people who are fully vaccinated are not getting infected as much. But then the only way we can ensure that we're really protecting people under 12 who can't be vaccinated or people who can't be vaccinated for medical reasons is by extending that out to a broader group. Regarding checking digital certificates and vaccination requirements, I think there's some confusion around what's required. For workers, it is a requirement. So workers, including volunteers, you will need to keep a record of everyone's vaccination requirement. And if the person should advise of any updates and changes to their vaccination requirement, we will at some point have to incorporate booster requirements as well, because there's a number of people starting to hit that 6-month point, especially people who are working with vulnerable groups and got vaccinated very early. They will be passing their 6 months and needing to get their boosters, and that will be incorporated at some point. So there will be the need to check for boosters as well, even though someone who's currently fully vaccinated, there's no obligation to sort of check up on their booster shot date. So around workers, recording it can just be a table in a document that notes people's names and their vaccination status and who's cited that. It's not keeping a copy of their vaccination certificate. That's not necessary. And it invokes a whole lot more privacy issues around keeping a record of someone's private health information. So it's probably safest just to keep a more limited record so that you can demonstrate that someone has checked it. With regards to patrons, it's just checking it. There's no recording it requirement. In limited circumstances, there's options to do that. So there is pre-registration options for education, for places of worship, and a limited number of cases for that. I believe it's physical rec. I'll get a message from one of my team sometime to confirm that. But I don't think that there's anything that broadly applies to community facilities that they can. So in limited cases, options for pre-registration, but that's not a standard practice because it's really important to ensure that we will have different people who are the check-in marshal each day. You do need to make sure that people are checking each and every time. Public and private gatherings is pretty unfettered at this point. So there's no limits on the number of people you can have to your premises or to meet within a public space. Of course, we clearly recommend applying COVID safe practices, keeping distance, wearing masks, and vaccination wherever possible. And then large events are back on as well, which is really exciting. There's a couple of conditions for events over 30,000 people, but otherwise we're all able to go and enjoy them as long as all staff and patrons are fully vaccinated. I think there was a question that I saw pop up in the Q&A. There's been a lot already, which is great, about activities on a private property. If it's formally work, the way that some people would have a home office, or you might have a hairdresser that's works out of their home, that then becomes a workspace. But if it was just a social party, then it becomes social. So there's clearly there's a line there that I think people need to apply some sort of common sense to about whether or not the vaccination requirements would apply. Is it formally a work activity, or is it entirely social activity? And then for disability settings, all disability services must comply with all of the different requirements within the directions. Workers will be covered in general by a worker vaccination requirement. And then there's a number of other, we need to start thinking about referring to OH&S and other guidance. So NDIS Code of Conduct, NDIS practice standards. These things are going to need to come back to the forefront of our mind in our day-to-day activities. So I think that covers the questions that I had previously. So I'm happy to take any that we can answer today.
Thanks, Lucy. I'm going to just run through some of them that are coming through. Some might have been covered, but so we're trying to work out which ones have been covered, but there might be some duplication. But so one was if someone has an exemption from having a vaccine, what is the proof that is required in that instance? Is it a doctor's certificate, or what complies?
Yes, this one's been tricky. It's moved a few times as the technology's caught up with things. It's been Service Victoria have done amazing work to manage to get their certificates up and running as quickly as they have. I know it's not an easy process, and initially some of that functionality wasn't available broadly to people with medical exemptions, and most of that has now caught up, which is great. But it does mean we have shifted away from a medical certificate from a doctor, and it does need to be that it is recorded in a person's medical records, immunisation history statement, which is available through the Australian Immunisation Register, where all of our records are, all of our past immunisations are recorded, so that people can now use a digital option, a certificate through Service Victoria. They can show it through a certificate from Medicare, and it says at the top of it that the person has medical contraindications, which means they can't get vaccinated, but they still get the certificate. And otherwise, the person can print those out. We haven't currently allowed the immunisation history statement as an option because it's a little bit more complicated. We have allowed that for individuals for their vaccination evidence, because I think most of us know that generally you're going to require 2 doses. There's a handful of vaccines where it can be a 1-dose vaccine, but none of them are currently offered in Australia. So it's pretty easy to check someone's history statement and see the 2 vaccinations, but a person would need to know the total number of vaccinations that are offered within Australia, to which someone needs to have a medical contraindication to check. So a little bit complicated, and we have not included that one at this time. But yeah, it's really great. Most of the electronic options are available.
And just linked to that, I think we had a question about somebody who had COVID, that had 1 vaccination, then they had COVID, and they then didn't need to have a second vaccination. Is that part of the medical exemption category, or how does that work?
Yeah, there is a medical exemption for an acute illness. Most of the time, it's only a short period of time where a person is recommended not to have like a dose of a COVID vaccine if they've had COVID. And generally, it's recommended that they can get their dose shortly after they've come out of that acute illness phase. For any exemption to that, it still would need to go through the Australian Immunisation Register, and that's if people are struggling with that, it's getting them to contact their GP. Their GP is the one that fills that form out and can upload it immediately and print it out on the day if that's helpful.
Yeah, that's great. And I think you will have seen there are lots and lots of questions about outdoor settings and outdoor events. And I think it's also the commingling of your volunteers, paid staff with the public, and the requirements for each. So can we just run through that again, just in terms of how that works?
Yes. Yeah, it is certainly complicated. The more that we go out and mingle, the more nuanced these settings become. In general, the principle is that if you are, if there is control over a group of people, if there's a designated area, then in that case, the vaccination requirements apply not only to the workers, but also the sort of patrons. So if you're thinking this isn't, if you have an event, if it's a street event where there's vendors alongside, but it's just an open street and anyone can come and go, then the workers will have vaccination requirements, but the public kind of coming and going through that space do not. Likewise, for a marathon, you've sort of got the corralled areas. It's expected that the workers, the volunteers there, and the attendees have a vaccination requirement. But clearly, the spectators along the course of sort of 42 kilometres, a little bit hard to control them and test their vaccination. So in those spectators are not a part of it. They just comply with the public gathering restrictions, and there are no restrictions on public gatherings. So it's a pretty easy one.
Okay, I think that's excellent. There was a question about the attestation questions and whether they could be reframed in more sort of friendly language, because I think that obviously one goes into aged care settings, disability settings, and sometimes those questions are a bit overwhelming maybe. Is there any thought about how one could deal with that?
I have great news. There's no attestation requirement anymore. That was removed very recently, and with all of the recent changes, not surprised that that hasn't come through to everyone yet. But if an organisation wants to keep an attestation requirement, they can, but then there's clearly no dictation in the show directions about how that would be worded.
Great. There are also quite a few on, I guess, part of the roadmap. How long will the mandating be likely to stay in place? Will booster shots be mandated? And then also, I guess it's because there will be those volunteers who choose not to get vaccinated and maybe are stood down or have to do remote volunteering. So what are we thinking in terms of when it's likely that they will be able to come back on?
I would love to have had a crystal ball through all of the pandemic. It would have made my life a lot easier. I think, unfortunately, this also falls under that sort of umbrella. At this point, it's been like, if we didn't have vaccination requirements, we've seen overseas that immunity wanes, and Europe has seen a huge outbreak in a number of countries, and some countries going back into lockdown. Exactly how that will be managed, and whether it's something where it's more centrally controlled, or do we leave it to individuals to manage, I can't say. It sort of really depends on a number of different epidemiological factors, and also how people respond, and how will people take up booster shots. So sorry, I don't have a great answer on that one yet. I think at this point, plan to continue as we are for the indefinite future, and whatever that means for encouraging people to work from home if they're not vaccinated, to stay engaged as much as possible.
Great, thanks. And then Lucy, can we also just run through the provision about face masks? When are they still required? When are they not? What is the responsibility, I guess, on the organisation to insist upon those, or should they, or do they have some choice? Could they say you have to wear them even though they're not required?
So there's still a requirement to carry it at all times. I still hook it around my elbow when I go out to get some exercise. There's a requirement to wear it in an indoor space at an education premises, so schools are. That's really protecting people under 12 who can't get vaccinated. And then in some other sort of settings that were probably not really relevant, prisons and remand centres, retail premises, which is more about our personal lives, and hospitals and care facilities, there is an ongoing requirement in that space. So it's fairly few and far between. It's generally where we have a number of groups of people who either can't be vaccinated or aren't vaccinated. So supermarkets, there's no vaccination requirement there. So it's important to keep them in kind of retail settings, especially as unvaccinated people can be walking through a kind of communal part of the shopping centre to get to that space. Generally in retail settings, it's really important to maintain that. But otherwise, there's very limited occasions. And so it's really up to an organisation. I'm sorry, I'm not a lawyer. I'm in the policy team, so I can't more broadly provide guidance on where an organisation can enforce it of their own volition. And so that's something that I think perhaps some further advice could be sought from lawyers to provide that guidance. Otherwise, I think it's just about encouraging people, especially where we're in contact with vulnerable people, that it's still a really, really effective means of minimising transmission.
Yep, that's good. Now this one probably, it's covered to some extent, I think, but it was a specific question, so it's worth just running through it. Essential food bank provision. So you're providing free community meals and volunteers are providing those. They are all vaccinated, masked. The meal attendees who come in, they are not required to be fully vaxxed. Is that how it works?
Yeah, that's correct. We definitely want to be able to keep access for people to those really essential services, food banks, the support cafes that are really there to provide free meals, hot meals, shelter for people. There's no vaccination requirement for the patrons. They should come in and be able to receive all of those essential services as freely as they need to.
Great. And then, of course, there are lots of questions about underage or minors volunteering and whether they are required to be vaccinated. Now, I think you've covered it a bit, but is there a difference between if you're under 12, under 16? Can you just give us a quick overview on what it means for minors?
Yeah, so the requirement for workers has been from around 12 for quite a long time, but it's been this kind of open premises directions group of, the liberties we're getting back where it shifted from 16 down to 12 more recently. The requirement is 12 and 2 months for vaccination for workers wherever there is a requirement. There are, as I said, a handful of cases where there is no requirement for vaccination, but in general, the vast majority of jobs and volunteering jobs are covered by a vaccination requirement. So from 12 and 2 months, there is a requirement that someone is fully vaccinated and provides their proof. A little bit tricky between 12 and 2 months and 14. It's not until someone's 14 that they can get access to their Medicare record by themselves, but a parent can download a copy of their vaccination certificate, save it on a child's smartphone, and they can show that until they are 14 and can access it themselves. And there's additional functionality coming through Service Victoria's app to enable a parent to sort of share the children's vaccination status to the children.
Okay, yeah, that's excellent. Obviously, there are increased responsibilities on organisations to keep records and notifications, and I think that you have said that a lot of it is about citing and just keeping a record of the fact that you have cited it. I think that there probably is a link to where one can find that information. But it would be good for organisations to know exactly where they could go to check, which possibly is the COVID safe planning page, maybe, would have all of the list of that information.
Yeah, the coronavirus.vic.gov.au website has quite a lot. A few of the pages have been updated recently, so if they're not currently live, they should be live very soon to provide some more information about vaccination requirements, how to check vaccination, and what's required for an organisation in recording that information as well. But yeah, in general, it's that there's no requirement to keep a copy of a certificate or a person's immunisation history statement. It's about recording down that it's been checked and what the status is.
Great. Just one COVID check-in marshals, are they required for outdoor activities?
They are in many cases. I might get my team to just give me a couple of dot points and I'll come back to you on exactly where.
Okay, great. So another one is just I guess the policing of vaccinations, whether there's any advice that could be provided, tools, guides on having those very difficult conversations, both with your volunteers or because you're in an environment where you're having to check the public as they come into your premises.
Yeah, it's certainly it can be a difficult conversation with people, and I think because often the people checking vaccination status are really the ones educating the public on what the conditions are for that certain setting. There are some documents that have been produced that provide that guidance and provide some suggested language about how to ask, how to share. I will share back through with you links to those after the event so that you can pass it on.
That would be great. Just in terms of density limits, is there a limit now? So for example, say an op shop or that kind of environment where there's a number where one has to check on the numbers, or has all of that fallen away?
In general, it's pretty much all gone. So limited circumstances. For retail settings where it's a fully vaccinated requirement, there's none for that sort of, Kmart, there's no density limit because we're expecting everyone there is going to be fully vaccinated, big events. So generally that's going to be the case, but there's also, it doesn't apply in a number of cases where you still do get some, you have a sort of mingling between vaccinated and unvaccinated people in community sport. But in general, there's no density requirements left. Okay,
great. And then just perhaps if we can just have a think about where there are some cases where volunteers are not considered workers, they fall within a different category. So one of our questions is about foster carers who are not mandated to be vaccinated, and maybe some instances of residential aged care where there are visitors, volunteers, so they're in a managed program and they are visitors to a residential aged care, but they are seen as visitors as opposed to workers, volunteers. Is there anything you could add on that?
I'd have to sort of come back and confirm on specific cases, and I think it gets difficult because there's so much nuance. And I think it's important to think about it like, is there an element of work, or is it truly a sort of, just any member of the public visitor situation, to be able to find that line and as to whether there would be any vaccination requirement applied in those circumstances. And then if they are visitors, it's sort of really up to the individual as a private visitor to think about how best they can protect the people they are going in visiting, especially if that's a sensitive setting.
Yep, okay, that's good. And there is a question about whether perhaps certain environments, so for example, op shops, could be considered essential services as opposed to just general retail, so that at least they fall within some of the requirements, because it might be tricky to manage those.
Yeah, it's a difficult circumstance, isn't it? That it's our lives are very mixed. We've got shops that sell various items, but also have a fantastic cafe in there, and sort of it's a question about what is their primary purpose in some cases. I think at the moment, op shops are considered general retail because they are providing that. It's a mingling of people. It's an important space to be able to protect people as well, especially if they are accessed by vulnerable communities. But I also recognise that that may be a group of people who haven't got vaccinated for various reasons, or may have sort of not be carrying on them the evidence of that in all circumstances. It's certainly not easy setting the conditions so that they work for everyone. And we're happy to have ongoing conversations about whether there is a need in some circumstances like op shops, but at the moment they are considered general retail like Kmart, and I think there are relatively low cost retailers that are likely to be accessed by vulnerable communities as well, and they would separately fall under this kind of general retail condition as well. It's very difficult. At what point would you draw the line in that? I think we're very fortunate that those businesses have set up great click and collect options, and the returns isn't too difficult. We've had 18 months testing this out. I think that there are probably hopefully organisations are helping people to be able to access that if they don't have access to the internet regularly themselves, that they could possibly do it through another means. I know that that's not going to work in all circumstances, though it does get difficult.
Thank you. If somebody has an overseas or an international vaccination certificate, is that accepted?
Yeah, that overseas stuff is like, we're progressing. We've done amazing things at getting the certificates all set up for Victorian residents, for Australian residents. The technology to support that for international people is not quite as robust at this stage. I know that there's a lot of people looking at how to deal with that, but of course there's 200 odd countries in the world. It gets very complex trying to work out how to set that up. Our border directions do list the requirements for for vaccination evidence for an international arrival. And for exemptions, I'd probably refer people to that. We can provide a link through if that's helpful after the fact. The people who are currently arriving have a certain set of prescribed documents that they have to have when they arrive in the country that the Commonwealth has organised. We've basically replicated that. So people should have this on them. And then there's also means by which a person, an international arrival, can have a record set up that sort of mirrors the Medicare records we have as well. And so I think if you've got lots of international people, encouraging them to look at the options to kind of connect into Australia's system, that will help make it as easy as possible for them as they go about.
Great, thanks, Lucy. One other question that came in is there an exception in working with Aboriginal communities, given sometimes the vaccination uptake is slower?
There isn't currently. I'm a little unclear on exactly in this case who the exemption would apply. If it's about the workers going in, then I think there's clearly no exemption because it's about protecting a community that would have a lower vaccination rate. And then if it's about that community accessing non-essential retail or being able to participate in the settings where we do have vaccination requirements, currently it's set that there's no exception for that, because it is about protecting a group of people who have a lower vaccination rate, and so working with those people to encourage them to get vaccinated, I think is really important. Anyone who's a vulnerable person and unvaccinated but could be vaccinated, it's the best means that we have to protect them.
Yes, that's great. And one that's kind of, there's a question related to men's sheds, and I know you work quite closely with them, as to whether members are patrons or volunteers. And I guess it then also links into community houses. To what extent people coming in, accessing on those, what are the requirements on them?
Oh, that's a really tricky question. Yeah, there is kind of a fuzzy line between working in volunteering and patrons in those settings, isn't there? I might take that on notice and come back and see if we can sort of clarify a bit more, but I think that it's going to be environments like these where it comes down to the organisation thinking about what is most relevant. And then the broad principle is everyone's going to have to be vaccinated in that setting, workers and patrons. The question is about who you are recording their information and who you're checking it. And so perhaps it's really up to that group about how they define it, and whether they're checking if someone's the secretary of the committee and they're turning up to a meeting. It's probably easiest for them to have their record as though they're a worker versus getting checked every single time. Whereas if you've got visitors or infrequent attendees who aren't really working with the community more actively there at that men's shed, then and just sort of irregular attendees, then checking their COVID vaccination status each time.
Great. We're getting close to ending. Just because it's popped up a few times. Is there a special case with clergy visiting residential aged care and whether they are exempt?
Yes, there is an exception that's relatively tightly defined around people who are sort of providing a religious service, and including in going to people's houses to provide that faith-based support or into a facility. There may be other circumstances in which there's, the organisation still might want to expect that of that person. And my understanding is that most faith groups have been really, really supportive of the vaccination requirements to protect their members.
Okay, great. So Lucy, just before I hand back to Scott, just to close us off, in terms of the way forward and what will happen with information on the websites, so with the frequently asked questions, will there be some sort of update and maybe areas where it can be specifically related to volunteers so that they can get that information pretty directly without trying to work out if they're a worker or not?
I think that, look, I'll take that back and see if we can just clarify the role of volunteers. But in principle, we generally consider volunteers as workers. They're doing really important work to support their communities. We see them as working and just not being paid for that work. And so I think reading any of the guidance, wherever it says worker, it means volunteer. It's quite clear in the directions that can include unpaid workers, so volunteers throughout. And I just also wanted to round back to the outdoor settings for vaccination requirements. I mentioned earlier kind of about a marathon as an event. Generally, the vaccination requirement is going to be just the same outdoors. So, physical rec facility, but there are certain exceptions. So one of the exceptions that might be relevant is for community sport. There's no vaccination requirement. And so in a setting where there's no vaccination requirement like community sport, there's generally no requirement to check vaccination status either. Okay,
yeah, that's great. Lucy, thank you very much. I'm going to just pop across to Scott, and he's going to do a close, but thank you both. That's wonderful.
Thanks.
How fast does an hour fly with the question? I believe there are over 85, maybe bumping up to 90 questions. So Lucy and Gary, thank you very much for your time and expertise. And as we've said before, we'll be taking these questions, trying to condense them into themes to help you understand, what is, relatively difficult. And you are in a very challenged position at times, trying to manage both your service delivery and then the addition of your mandate. And so we sympathise with your position. We also sympathise with the fact that you are the critical infrastructure that is going to build us back from this pandemic, both through the social and economic impacts. And so, again, we thank you for what you're doing for making Victoria a strong and resilient community. For something lighter, perhaps, we encourage you to come join us tomorrow when we deliberate on whether COVID has cancelled volunteering. We have a comedian, Geraldine Quinn, moderating, and we've got speakers including Andrew Lee, MP, Federal for Labour, Lisa Szymanski, CEO of Volunteering Tasmania, Celia Tran, and Angela Seach, giving their opinions on that big question of, has cancel culture hit volunteering? I'll put that in the chat box in the next second or so. But thank you again. This has been really valuable. Thank you to our speakers. Thank you for engaging, and do keep on our website. We will be maintaining this web page up to date as best as we can with these really important questions. All the best with the rest of your day, and we look forward to seeing you again for future events like this in the very near future. Thank you, everybody.
Thank you.
Thank you.
Bye.
Bye.